Yeah, I appreciate all of you coming out today. We wanted to get you together and share some information on how we're preparing for COVID-19. Try to encourage some people to take this very seriously and answer some questions that you might have relative to what we're doing and the direction we're being given from the Alabama Department of Public Health, the CDC, and others who are helping guide how we take care of the populations we serve during this process. To start with, I'm going to reinforce what you've probably heard numerous times. The best way to keep this from spreading is separation and sanitation. Stay away from other people, wash your hands, sanitize your hands. I will say that over and over again. Separation and sanitation is the best defense we've got against keeping numerous people from getting this. I also have encouraged our organization, we're taking steps to limit gatherings of large people. I would encourage everybody in the community to take those same steps. There's no reason to get a large number of people in a room close together. Again, avoidance of other people is the best way to break the chain of people who are passing this on to one another. I will say that this morning we were notified by the Alabama Department of Public Health that there's now a confirmed case in the state of Alabama. That was in Montgomery County. At this time, we do not have a confirmed case in Huntsville or any of our other facilities. We have tested numerous people, including people yesterday, where we do not have the test results back. But at this time, we don't have a confirmed case in our facilities in North Alabama. I would like to say that, in times like this, the rumor mill and social media can disseminate misinformation in a very quick way. I encourage people to look at our website. We're going to set a hot link up on our website so that we can pass information along to you every day about the status as we get it from the Alabama Department of Public Health, along with other links to credible agencies that can tell you how to deal with this and what's going on around the country. The link that we have will have hot links to those other links. It's up now. If you go on our website, huntsvillehospital.org, you should see a red banner across our website. Click on that and it'll take you that information. We believe this information was co-developed with the Alabama Hospital Association so that every hospital in the state will get the same information and have the ability to put it on their websites. We would like for the hospitals to serve as a resource to communities that we serve. We would also like to make sure that we're getting out consistent information. I will get back to the rumor mill. I made a mistake last night of trying to respond to social media. I was up all night responding to social media, but there's just a lot of misinformation out there. So please use credible websites and use credible information as you make your decisions around how you take care of yourself and your loved ones during this process. Specifically, for our facilities here in North Alabama, we're implementing some measures to protect our patients and our staff. It is vital that we protect our staff. In a normal flu season, 95% of our staff get a flu shot. So we don't have to worry about our staff being home sick. They're there to take care of people. We don't have flu shots for this virus. So we got to take extra precautions to protect our staff, because if you need hospitalization, you need our staff there. We have limited visitation. We're asking people to limit visitation to patients. I would take that a step further and tell you, if you do not have to visit someone in a hospital, do not visit someone in a hospital. Many of our local nursing homes, and I applaud them because the people in nursing homes are the most vulnerable to this disease, have eliminated visitation, and I applaud them for doing that. I think that is a wise move. In hospitals, we haven't gone to that step yet. I'm not discounting that we won't go there. At this time, we're asking for people to use common sense and avoid visitations if at all possible. In addition to that, when you're here, you're going to see signs all over the place to sanitize your hand. We've got hand cleaner everywhere. If people need a mask, we have access to them. We had them out, but people were putting them in their pockets and walking away with them, so we had to start allocating them at the nursing stations. But we will make sure when people are here that they are reminded constantly to wash their hands and sanitize and still keep their distance. The last thing you want to do is walk into a room to visit a patient and hug somebody. You shouldn't ever do that. You certainly shouldn't do that in this particular time. I will say this, it's not a time to panic. We've all seen what's going on around the country. It seems to me like people are either panicking or they just ignored it. There seems to be no in between. It's not a time to panic. It's a time to be smart. If we're smart and we do what's being recommended, we'll be able to mitigate this, and we'll be able to handle the people that need a hospital. Also keep in mind, most people that get this don't need a hospital. Most people don't need to come to the hospital to be diagnosed for this. We're going to talk about that in a minute. We're going to talk about multiple options to get diagnosed for this in a very short period of time. The lab companies and others are gearing up to make this available to people. But again, the vast majority of people who get this go home, get sick, get over it, go back to work, and life goes on. We're trying to protect those most vulnerable people who this seems to have the most devastating impact on. So if you would, please be smart. Remember separation, sanitation. Use common sense, and we'll all get through this, and we'll be okay. So with that, I'm going to turn it over to Jeff Sams. He's the Chief Operating Officer of Huntsville Hospital Health System. He's going to get into some specifics that we're working on, and then we'll take questions if you have any. If you have any. All right, thank you.
Thank you, David. So, as David mentioned, we're taking steps, and this is throughout our system, to protect our staff. We have treated these communicable diseases for years. Our staff know how to handle these situations. They know how to protect themselves. So we can do that as long as we have the staff and the equipment to do so. So as David mentioned, the visitor limitations, the hand sanitation. We've also stopped shadowers and observers and unnecessary sales personnel in the hospital. Basically, if you don't need to be in the hospital, we're not allowing you in. For our own staff, to protect each other, we've canceled all business travel for our staff. We're not having large meetings. I had a meeting this morning, and we use every other chair. The simple things, you think it can't happen to you, but I'm try to keep yourself 6 feet away from other people. Our protective equipment, we currently have an adequate supply of personal protective equipment for our staff, but we worry about it being overutilized. So we're managing that very carefully and trying to make sure we monitor and utilize that. David mentioned some of the testing options. So there's an effort underway being coordinated by the Hospital Association in coordination with the Department of Public Health to increase testing, make testing much more widely available. So the current effort is to have a capacity to be able to collect specimens in a safe and efficient manner. So if your personal physician wants you to be tested, there'd be somewhere you can go to have that specimen captured and then sent off to the state to be processed. So we're trying to get that established, and I think there'll be more details about that next week. It's a statewide effort, and there's a fair amount of coordination going on, but we hope that will be available. So if your doctor thinks you need to be tested, there'll be somewhere to go where you can even potentially do that over the phone and not have to go to their office. Capturing these specimens and handling them requires viral media that not just everyone has. So we have to make sure that process works well. Locally here in Huntsville, Tracy and the clinical team are exploring creating an additional, it's called a flu clinic or a fever clinic, that's specifically designed to help people who may not have a personal physician or may not feel comfortable going there. So this would be an urgent care type setting where you would see a physician or nurse practitioner be evaluated and treated and tested there on the spot. We're trying to set this up for a short term to give people an option that is not the emergency department for these lower acuity patients who may just need to see somebody and get tested. So we hope we have that available next week. We're trying some innovative things. We may even do some things in your car. If we don't need to bring you into hospital around other people, we're going to try not to. So we're working hard to stand that up and have an option that will help keep people out of the ER and give them an option to be treated. Another thing Tracy and Robert and our clinical teams have done, we have had surge capacity and pandemic plans for years, and we update them annually. So all those have been reviewed. We have counted our ventilators. We have counted our isolation rooms. We know what our capacity is. We've brainstormed how to work if we're short-staffed. I just want to assure the community that we've done all those things to be as ready as we can be to care for patients. Lastly, I wanted to comment a little bit about what I know about the availability of testing. So up until just the last day or two, testing in Alabama has been limited to the state lab. That is expanding pretty rapidly. Several of the private labs are already available to accept samples, so that is increasing availability. And that will, I think, expand rapidly next week. We hope in the hospital on our lab equipment, we're talking to our manufacturers, and we hope they will have testing available within a week or two. So we hope to be able to process these tests ourselves within a week or two. And I think options will get much better. So we'll see how that evolves. But I think testing will be available much more efficiently in the coming week. With that, I'd be happy to answer any questions, and I've got Dr. Chappell and Tracy here to help me with that.
Jeff, one thing that I just want to mention, I failed to say it, I had it in my notes, but we'll remind the public, if you have a little fever and you feel a little upset, you don't come to the emergency department. We can't inundate the emergency department with people who don't need to be in the emergency department. So, as Jeff mentioned, we're going to have a lot of other outlets to keep people out of the hospital and in other locations that are more convenient to them, but also protect those people who actually need the emergency department.
Yeah.
Again, most people that get this, the vast majority, they go home, they get sick, they get over it, and it's okay. And we want to make sure those people just know that they've got something and they get home immediately.
I think personally 3 or 4 things can be true at the same time. Most of us probably won't get this. Most of the people that do, as David said, will get well very quickly. And then there are some people who are going to get it and be very, very sick. And we know that from what we've seen in China, other countries, in Seattle. So we have to take it very seriously and make sure for those people that do get very, very sick, the rest of us do our job to prevent that, and that our healthcare systems are ready to respond, and we have ICU capacity and we don't get overwhelmed. So we're asking for help to keep that subset of our population who does get very sick, that we can take care of them.
Hi there, I'm Dallas Parker with WHNT News 19. Just going off of the fluidity of the contingents plan here, currently, can you answer the amount of open beds you have here, and where do you put patients if you happen to run out of space here at the hospital?
Without a specific number, we have adequate beds open to take care of patients now. Patients are always moving in and out of our system from the ICU to the floor and from other hospitals. We have plans where we can expand and have patients in different areas that are non-traditional, like our OR suites, our PACU, and our cath lab suites. So we have plans in place to ramp up to take care of these patients if we need to. David and Jeff both mentioned a very valid point. And I'll say it again, to make sure you're sanitizing your hands and you're separating yourself from others. What we don't want are people who are we call the walking well to come to our ERs. We want those people to first call your family physician to see what you need to do. If you don't have a family physician, go to urgent care center. If you can't get to urgent care center, the Alabama Department of Public Health on their website has 2 phone numbers they can call and get directions. So we want people to do those things. Call their family physician, go to urgent care center, or call the number that the Alabama Department of Public Health has put out there. We don't want to overrun our ERs and our healthcare system, so we can take care of that small subset of patients that really need us.
Sydney Martin with Channel 31. With this virus, I know the State Department of Health said it could take 24 to 72 hours to get results back. So if you guys had testing here, could that speed up that process?
I think it would. Currently, the testing we're getting back in the last few days from the state had been coming back in about 24 hours. If we're able to process the test, when we're able to process the test here at the hospital, I expect that to be down under, 3 or 4 hours. The processing time is actually manageable. It's a matter of getting the specimen collected and couriering it to the lab. So we eliminate all that travel time. And just as capacity comes online, we'll get rid of bottlenecks. So I think we'll get test turnaround very quickly once we can do it here at Huntsville.
Can I add one? How many people have been tested here locally?
I think we've sent something like 20 or 24 patients to the state, and all those have come back negative. Changes every day. I think we sent how many yesterday?
5 yesterday.
5 yesterday?
And have those come back yet, or?
They have. I don't believe they have.
But as far as it goes, so far, nobody hears.
Nobody here has tested positive.
No staff, no patients, no physicians have tested positive.
I might add one thing on the commercial testing. any test that's done by a commercial, whether it's our lab or another vendor, if it becomes positive by the commercial vendor, it will have to go to the state for confirmation.
And you guys won't get that information until it comes back from the state.
We'll know
Just
the
to clarify.
if we do it or we use a commercial lab, we'll know the presumptive result, kind of that early result, and then it goes to the state for the confirmatory testing. Because this is a public health crisis, there are rules about reporting. That's why we get the good reporting, is because everybody's required to send this to the Department of Public Health, and they can consolidate and track it.
I think for the first 24 hours, if you come in and we're testing you, we tell you to do the same thing as if we thought you had it. We only release you from doing that if we get a negative response. So the 24 hours should not be impacting how we're treating those patients. We're telling you, go home, isolate, do these things. Remember, the treatment for this is to go home, drink plenty of fluids, do the things you normally do when you've got the flu and don't have. So it's not changing the treatment, that 24-hour period. But 24 hours from now, we can say, hey, you don't have it. You still may be sick, do what you were going to do, but you don't have it. But it really doesn't change how we treat those patients.
I'm Jenna Ram with WAFF 48 News. There's several states in the country that have dozens of people with confirmed cases. Is that because they have widespread testing available, that they're able to confirm more cases?
Yeah, I can't say. I think it's impossible to answer that question. I think the testing in Alabama has been adequate. I think the Public Health Department has done a great job trying to use the resources they have to take care of the state. So I can't answer what happened in another state.
Yeah, I'd be glad to speculate on that because you just,
Yeah.
so.
It just seemed like there had been like a shortage of tests or something
population
like
density.
that.
We have a low
Yeah.
population density in Alabama. If you go to other places where it's more dense, if one person shows up and they have it, many other people are going to get it. So by luck of the draw, whoever's got it in Alabama, the person in Montgomery, was not around a bunch of people, or we'd have a lot more cases. So the fact that we, that's a fact that plays into it. I think another one is believe it or not, we kind of jumped on this early and told people, back up, start canceling meetings and do those things. We started early and we think others started early. So I think that helped. Doesn't mean we won't get a lot more, but I think it helped us to be later in the curve.
That was kind of my next question. You said testing is going to become more widespread. Do you think it's inevitable that more cases are going to start popping up as that testing is more widespreadly available?
I think as more testing, I think as more people get tested, you will find more cases because that's the nature of this. It's transmitted and other people get it. Yes, I think that's true. I don't necessarily think that the testing process so far has been an impediment to us knowing who has it.
Okay, and then just kind of along with the ER thing that you've already mentioned, calling 911, getting that ambulance transport for this disease, that puts our first responders at risk. Can you explain the importance of people, not doing that and taking the measures that you guys are putting in place to preserve your staff and first responders?
I want you to hear that from our chief medical officer. He's the doctor. Let him, because I think people really need to pay attention to what he's saying, because you're hitting on a good point, what people should not do.
Okay, so most people are going to have fever, they're going to have cough, sore throat, muscle aches, and as you know, right now in Alabama, the most common cause of that is the flu, not COVID-19. So if you have those symptoms, you certainly, you want to do the same thing you would do at the flu, which would be check with your doctor. You wouldn't want to panic and call 911. As Jeff said, there are people, though, that are going to get COVID-19 that are going to be very ill, especially those that are at risk. And if that happens, certainly our ER is going to be available, and we want it to be available to take care of those patients, not the ones that have very mild symptoms.
Hi, I'm Lee Roop with AL.com. So we've heard reports that some doctors in the community are responding to calls from their patients by saying, go to the hospital, go to the ER. Is that what's happening routinely, and do you have what you need to collect the specimens?
So we have seen some of that, and some of the patients that have come in the ER have been otherwise fairly low acuity. So that is a very high resource environment to care for low acuity patients. So we're hoping these other testing mechanisms, so if we can stand up this network of specimen collection to use the state lab, if we can make that work, then that physician office has a way to help manage their patient maybe without even bringing them to the office. So we're hoping that augments the physician community and gives them another resource to do this efficiently and effectively. One of these things we're doing is try to keep people apart. So, if we can keep you in your car, that is the best thing. So we're exploring some of those ideas. So we've seen a few of those. We're trying to do some things to support the community providers by giving them more options to test.
Do you have to be?
Seriously, just,
Yes.
keep in mind, Huntsville Hospital is a safety net hospital for North Alabama. Anytime anybody thinks somebody needs something and they can't deal with it, they come to Huntsville Hospital. We love the fact that people look at us to do that. We're educating people that in this situation, there are many patients that don't need to do that. I think there was some initial reaction because some of the doctors didn't have testing equipment. Just go to Huntsville, because that's the way people handle medical cases they can't care for. Just go to Huntsville. That's what we're here for. What we're trying to do now is reset the deck and say, okay, for these people, get treated in an outpatient setting, get treated away from the hospital. Don't clog up our ER if you don't need to be there.
Do you know how many testing kits you guys have?
The testing kits is different. So it's a viral collection kit to collect the specimen. We have plenty of those. That's something we always have. It's the other side of the testing kit of the reagents and things you need to process that. So there's two things of getting the specimen, collecting it, and then having the ability to process it. The processing to this point has been in Montgomery at the state lab, but we have plenty of capacity inside to collect the specimens. But not all physicians' offices do have that. So there are plenty of physicians' offices who might not be able to collect it. So that's why we need to augment that.
How do you collect the samples? Like a flu test?
So that varies. So this, as my understanding, I'll let Tracy talk about that. He's a nurse, he'll do a better job with it. So
So the testing currently today consists of a nasal swab, oropharyngeal swab, and a sputum production, cough up something in a cup. I'm not trying to be gross, but those are the three ways to test for it. As we move forward, it might just move to a nasal swab, but as of today, those are the three ways you test for it.
So you mentioned 23, 24 sent down to the state. Is that all the people that have showed up that you've tested?
we have had other people come in who have said, I have a fever, I think I might have that, but they don't pass any of the other screening criteria to actually have the test done. So there've been more than that evaluated. That's the number where we've kind of said, okay, that's enough boxes checked to send the test off and get an answer back. And so far, all those have come back negative.
Has the number that showed up stressed the ER?
Currently, so far, the ER has not been stressed. We have a great group of physicians and staff members that are doing a great job taking care of those patients. They've planned for capacity issues just in general if there's anything that happens in our community. So they've used those plans in place, and it hasn't been stressed so far. But our goal is not to have it stressed by taking these measures in the physicians' offices, calling ADPH, and/or going to our urgent care center.
You said some people showed up and didn't check off the boxes to be tested, but I guess today the State Department of Health said that anybody who wants to be tested can automatically be tested. So is that going to change, I guess, now?
I can answer that. Just I think yesterday, the Department of Public Health changed their guidance for so now I think at this point, if a physician thinks a patient should be tested, those tests can be run. Up until prior to that, it required both of that and some screening criteria. So that has changed, and I think going forward, if a physician believes you need the test, you can have the test. I do think it still requires an order from a physician or a nurse practitioner or a physician's assistant.
So to clarify, you can't just walk in
can't
and
just
say,
walk.
You can't
"I
just
wanna
walk-
be tested for coronavirus."
Not at this point. Now, that may spring up somewhere, but not at this point.
The original screening criteria was developed by CDC. We were following their guidelines on who met the criteria to actually get a test. So it wasn't criteria we developed, it was criteria being used all over the country to determine. There was a series of questions and you had to check off enough boxes, go, oh yeah, they are in the risk group, so let's test for them. And I do think that was related to the fact that there were a limited number of test kits in the United States. Let's make sure we're testing appropriately. You wouldn't want to talk for a long time.
I'm
You go
Cindy
right
Stallworth,
ahead.
Fox 54. So you mentioned that some people did come in, but they didn't meet certain screening requirements. Can you share with us what a few of those requirements are?
So the initial screening criteria included having a high fever, of course, the normal cold and flu-like symptoms, You had to have travel to an affected area, what they called a level 3 area of the countries that had the highest concentration of COVID-19, and also or be in direct contact with a person that had confirmed COVID-19 were the screening criteria that we would go through.
Now, of course, we don't want it to get to this point, but if resources become limited here, how do you all go about requesting assistance? Do you do that at the state level? And how is the federal proposals, how are they going to coincide with what you do here at Huntsville Hospital?
Yeah, you know, the local, Tommy Battle is here, I believe he was here a minute ago. He's back in the back. Tommy, Dale Strong, Paul Finley, other local officials have offered their assistance if we need it, and they have resources. We have stored resources for tornadoes that we have available that has masks and things like that, and that's been made available to us if we need it. HIMSI has EMTs and clinical people that could help us if we need it. At the state level, we have not asked for resources from them yet, but I assume they're going to be looking at how they might be able to help resource some of this. There's a very small amount of money that's been allocated to the state of Alabama. I think it's like $8 million. You know, at this point, I guess that's a good start, but to be determined if we need more money. When you start talking about the things that Jeff talked about, setting up clinics and all these types of things, we have to set them up, we have to staff them, we have to run them. That costs money and it takes people away from the jobs they were doing. So we'll have to manage that. You know, we're a big operation. We manage change very well because things change pretty regularly. But we feel very comfortable right now with the support we're getting from all of our local officials in particular. They've been wonderful. They've been on the phone with me every night saying, what can I do to help? And then I won't say every night, but on a regular basis. I won't get you every night, Tommy, but on a regular basis. And we're in constant contact with state officials and if we need resources from them. So, you know, what we're just, you know, we are trying our best to prepare for the worst, right? That's our job. We got to prepare for the worst. And that's why, you know, I would tell people, I told somebody the other day, I said, somebody was boohooing with me on social media that this is all a political hoax. And I said, well, yeah, but why would you put your mother at risk? Why would you do that to her? If you don't believe it, fine for what you do, but don't go out here and do all this stuff and then go visit your mother and put her at risk. At least take the precaution just in case it's not a political hoax, which I don't think is a political hoax. I think people need to pay attention. Well,
One other comment about resources. We have a system of hospitals in northern Alabama. There's many patients that are hospitalized for this may not need to come to Huntsville Hospital. So we believe our community hospitals in Sheffield and Decatur and Athens and Madison and Marshall County, all our hospitals can safely care for most of these patients that need to be hospitalized. So we've been educating them as well, and we have those other beds and resources throughout our system. So just because you have this and need to be in the hospital doesn't mean you need to race to Huntsville. We can use our whole system and save the ICU beds in Huntsville for the sickest patients.
Can you talk about if there's maybe any group of researchers or doctors or nurses that have maybe been pulled off their normal duties to look into COVID-19 or any kind of work that they might be doing here?
I'm sure they have. That clinical research is not really our thing, but I suspect at every academic medical center, at some of the genetics research that happens in Huntsville, I suspect those people are burning the midnight oil to try to find novel ways to prevent and treat this disease. Not here. We really don't have that kind of basic
we're not a
science.
research institution, so that's not our sweet spot.
My name is Ashley Remkus. I'm a reporter at AL.com. I just wanted to ask, I mean, there are several people in the community who have jobs that, you know, don't allow them to quarantine at home or to avoid people or social distance in the way that, you know, some of us can. Are you guys given any kind of, you know, suggestions or tips or working with law enforcement or other first responders about the best ways for them to care for themselves and others at this point?
Yeah, I'll let one of the clinical team over here address how they might do that. You know, that's a tough one. That's a tough one. And I think some people's lives are going to be disrupted because if they're diagnosed, they just can't go to work. They need to go quarantine. That's the hardest thing about this is America's a free place. We love to get up and go and do what we want to do. And, you know, our lives are going to be disrupted a little bit. Even though I'm not real sick, if I've got it, you know, Tom Hanks and his wife, they're on TV. You can tell they're not very sick, but they're quarantining. And, you know, if you work in a restaurant and you got it, you can't go to work. So I think we're going to have to figure out how to manage that. People are going to have to pitch in and help the coworkers and those types of things and do what we do we always step up in a crisis. And if people start getting sick and they can't go to work, then I hope their fellow employees will step up and help them out. That's about the best I can give you on that one right now. As far as protecting people in the environment, you could talk to one of these two about that.
The only other thing I could suggest, if if a person is sick and they can't quarantine, they can certainly wear a mask. And that's one thing they can do. And I know the EMS workers, if they go into an environment with somebody that's sick, the first thing they can do is put a mask on unless they have a condition that would not allow that.
Are there any other specific tips or suggestions or thoughts that you guys have about, like I said, law enforcement, they don't really have a choice, I guess, at, who they get to deal with on a day. So, I mean, is there anything else that y'all would suggest to those agencies about ways to prepare?
Go ahead.
No, I think, I'm sure Tommy might even be able to address this, but I'm sure law enforcement's looking at making sure they wear gloves and do all these types of things when they touch people and so forth and so on, try to protect themselves, which they probably already do in many cases. I think everybody will take more precautions and immediately wash your hands and sanitize and do those types of things. I can't tell you how important that is in keeping this from spreading.
Let's flash forward a couple of weeks, 3 weeks, maybe a month. I'm guessing there will be more cases. I guess you're planning for that. Now, you mentioned the other hospitals in your system. Can you talk about, as this thing scales up, will you be able to handle it if it does, and what is the plan?
As Tracy mentioned, we have what we call surge capacity, which allows us to take additional patients. In our entire system, we have, 1,700 beds across North Alabama, so we've got a lot of beds. We would distribute patients across that. If it got to it, we would possibly have to look at limiting elective surgeries and taking low acuity patients that are in the hospital that don't need to be in the hospital out of the hospital to create capacity. Can I sit here and promise you that this won't strain our capacity at some point? No, I can't do that. I mean, if you look at Italy, they did not do what we're trying to do in America, and that's break the chain. And everybody got it at once and everything peaked. And that is what flooded the hospitals. When we tell you don't have gatherings, stay 6 feet apart, separate, people will get this, but if they get it in a much more linear fashion, then we will be able to handle it. And that's why we keep stressing what we're stressing. I mentioned it again, we are trying to limit people coming to the hospital because we do not want our caregivers to get sick. Because if 20% of our caregivers are gone, our capacity falls by that amount. Not quite, because in a crisis, everybody steps up and does more. So planning for it, believe we've got capacity now, but I have no crystal ball to predict what it's going to be like 2 weeks from now or 3 weeks from now.
Any more questions?
One more.
One more. Okay.
Sorry, it's kind of a twofold. So President Trump is speaking in about 40 minutes, addressing the nation once again. We're expecting a national emergency to be issued. My first part of this question is, can you reassure people that the words national emergency is just a phrase that is used for a term like this, and it's not to incite more panic?
Well,
Governor Ivey issues a state of emergency when we have flooding.
I certainly hope it doesn't create more panic. I hope it raises the awareness in people to take this seriously. At some point, I wouldn't be surprised if the state declares an emergency. There are certain things that happen when national emergencies and state emergencies are declared that allow us to do some things that we can't do. We are the most highly regulated industry in America, probably other than the nuclear power industry. Setting up this clinic we're talking about, we have many more options in an emergency situation than we do in a normal operating condition. So don't think that just because there's a national emergency or a state emergency announced that all of a sudden things are that much worse and people need to panic.
So that's
It
kind of
gives us options that we don't have before that's declared.
That's my second prong to
Yeah.
the question is, if this is issued a state of emergency or national emergency, what kind of resources does this open you guys up to kind of expand your testing, expand care, expand preparedness, stuff like that?
Yeah, I don't have the exact list. I mean, it opens up a lot of opportunity, and with money too, and support and so forth and so on. We'll have to see what's available when and if that gets announced. But I do know that there's a relaxation in the rules and regulations as to caregivers and those types of things. You know, it's everybody can step up and help, whereas right now, you have to have all kind of criteria and check boxes before you can do that. No more questions, but I would like to say one thing before we finish. We did this because we want to be a resource for information. Please look at our website. If we need to get back together and have another one of these, we'll be glad to do so. I would look to the media to help us with the rumor mill and the social media that kind of gets out of hand. We want to be very transparent. We've always tried to be transparent with you, and that's what we're doing today. So please don't hesitate to contact us if you need additional information. Right? Thank you.